Graham Cassidy is a diversion. It's smoke and mirrors that simply kicks the Obamacare collapse can down the road a little bit. Joining me now from New York City, family care physician and Obamacare expert, Dr. Jonathan Vitale. Doctor, when I hear about this so-called repeal, I say schlemiel. It is not a repeal of Obamacare in any way, shape, or form. These block grants to state, it's a good idea on paper, but this is some sort of kind of reverse, perverse federalism. This is not what the framers of the Constitution would want. It's not what they would approve of. They would approve of, yes, abiding by the 9th and the 10th Amendments, but allowing the people to retain and obtain their own health care of choice using their own money with no government input whatsoever.
Yeah, well, first of all, Graham, thanks for having me. This is certainly not a repeal and replace of Obamacare that we've all been hoping for. I think that ship has sailed, at least for this administration, unfortunately. But I think this is the absolute closest we're going to get at this time. I mean, look at this plan. Essentially, what it does is it takes the Obamacare funds and it block grants it back to states, right? And then it also is going to get rid of the individual mandate as well as the employer mandate. It's also going to reduce the expansion of Medicaid and also help things like catastrophic care be legal and affordable, and it's going to expand health savings accounts. What it's not going to do is it's not going to repeal all of the taxes of Obamacare, and it's not going to repeal all the regulation of Obamacare. So it still has that framework, but what it comes down to is one thing. It comes down to flexibility that states are now going to have. Right. And you're absolutely right. This is not free market care. I don't even know that it's a step towards free market care, but it's the best that we have right now with the tools that we have in the Senate.
Okay, you went through it. I want to look at it again. So here is the plan in a nutshell. And as you mentioned, it's centered upon block grants. It would end the current Obamacare system as we know it and turn it into block grants to the states. The states would then be able to waive requirements that health insurers cover certain benefits, for example, men having to pay for mammograms. It would end the individual mandate and the employer mandate. Okay, but as you mentioned, the regulations stay in place. So if you're the state of California or the state of New York, which you happen to be in the state of New York, and you're looking at this and you're seeing, oh, all this money coming your way from the federal government, you're going to be salivating because all you're going to do is expand what I would consider government control health care, at least on the state level, would you not?
Well, you're absolutely right. You have to take a few things into consideration here. One is in this plan, it's really essentially going to be reshuffling the money, most of which is going to be going to the states, the Republican states that did not take the expansion of Medicaid. So that wouldn't be states like California and New York. But the other thing is this, and this is kind of the scary part about this, is California and New York have already tried to institute universal health care, and they failed. Some states, such as Vermont, actually passed it, and it failed dismally. They had to rescind it after it was passed. So it's going to be very interesting to see what states are actually going to do with the funds that they get. There's going to be 50 different laboratories of healthcare here, and we're going to see what works and what doesn't. Now, something to keep in mind here, Graham, is there is some bias baked into this plan, right? If a state wants to pursue a single-payer system, they can do that. If a state wants to do more of a free market solution, they have to actually get a waiver from the government in order to pursue those free market solutions. So, and the thing to realize also is if this passes, once these states get these funds, they're going to have to act relatively quickly. I'm talking about 12 to 18 months. So we don't know what's going to happen in those states, but we've seen what's happened before when some states do try to pursue a single-payer system.
I think it's pretty predictable in a state like California. That's exactly what they're going to do. They're going to try and salvage whatever system they have right now. It's called Covered California, and they're going to go for the single-payer. There's already been a movement in California and other states to go in that direction, and I think that this is going to open the door for something like that. And it's going to, in the end, I hate to say, it's going to create chaos in the healthcare system. But you mentioned Medicaid, and the Medicaid expansion ostensibly being truncated. It may or may not be true. Let's stipulate that it is true that this plan is going to somehow stop the Medicaid expansion, but it's not going to stop the bleeding. The damage is done with Medicaid, is it not? Because of the expansion through Obamacare. You know, when they talk about the Obamacare numbers, and they come out here, Barack Obama and the other ones who make up these excuses for how well the Affordable Care Act in their mind is working, and they talk about all the people, quote, signed up, many of those people were through Medicaid.
Yeah, that's absolutely true. So that number, the 11.4 million people who are under Obamacare currently, many of them were under Medicaid or would have qualified for other programs. The thing to understand here is this, Graham. We talk so much about what happens once Obamacare collapses, right? Next year, there's going to be 45% of counties which are just going to have one insurer on the exchanges, and premiums are going to go up by at least 15% nationwide. So let's say Obamacare absolutely does collapse and there's zero insurers. Then what? What happens is these states are going to have to absorb these patients into the Medicaid programs, and it would be chaos. You're right. I think that what this program does, the silver lining, if there is any, is that it gives states a little bit of forewarning, and it helps them to prepare for what happens when they have to take on these additional patients. Medicaid in general is already bursting at its seams in most states. But look, governors should understand how to take care of their populations specific to their states. I mean, the populations of California is going to have very different needs than the population of, you know, of Mississippi or Rhode Island. And it's best up to the governors to kind of understand how to best use the funds. You see nowadays a lot of issues with the opioid crisis in states like West Virginia or Alaska or Ohio. And this is one of those areas where the governors are going to be able to direct funds in that particular way to help the process.
All right. Can you spend 30, 45 seconds on Medicaid and why doctors don't want to take new Medicaid patients? Does it boil down to the government mandates in terms of how you treat a patient, how much time you spend with a patient, how much you get paid for working with that patient?
Yep. Yeah, so Graham, when doctors don't like seeing patients who have Medicaid, not because we don't want to take care of those patients, we absolutely do, but what happens is the reimbursement is so low for patients who are on Medicaid, and we can't order the tests that we want to order. We can't even prescribe the medications that we want to prescribe for those patients. So it's very difficult to take care of those patients. Many physicians would much rather volunteer or donate their time to take care of patients such as that and take care of them in the way that we want to, rather than have to deal with these government bureaucracies that dictate how we can take care of the patients.
Okay.
So Medicaid is a very bad system, and I mean you can give everybody in the country Medicaid, but that doesn't necessarily mean that there's going to be doctors available to take care of them.
And of course Bernie Sanders wants to give Medicare for all, which is a single payer. but we swerved into the mandates here, that the Obamacare mandates. You remove the individual mandate, you remove the employer mandate. People are going to necessarily drop out of the system. Businesses will no longer offer health care because they were forced to offer health care. Many of them will drop out. Costs are going to start spiraling up as people drop out necessarily. Don't you see that coming?
Yes, I certainly do. I mean, I think that there's some solutions here. Rand Paul has been talking about these healthcare associations. He claims that he's been having these negotiations with President Trump about it, and that they may even be revealing a plan that allows that. But what that essentially means is it would be a great thing if people could join together and join these associations and have enormous purchasing power. So instead of you being one person trying to buy an insurance plan, you could be a member of a group of 15 million, maybe of the AARP or other organizations. You'd have a tremendous purchasing power, and at that point you could essentially write your own ticket for what you would want in your insurance plan, and the private insurers would accommodate because of the vast numbers of folks. So I think that there are solutions, but this is not a solution. It's a start of the conversation.
But you're on record saying, hey, this is okay. I mean, it's not quite what we want. It's kind of like kissing your sister, but we'll take it.
Well, Graham, I'm not a politician. I do not like the Graham Cassidy, but I don't like Obamacare anymore, and I don't see that we have any other option right now. And we literally have only a few more days until the end of the month. I think this will give states more flexibility, which will ultimately be better for patients. But this does not even scratch the surface of the plethora of other problems we have in healthcare in this country. It doesn't even scratch the surface. But to start.
I hate to be a gloom and doomer, but I think as long as government has its tentacles in our healthcare system, especially as long as Medicare, Medicaid, and the VA exist, I think we unfortunately remain, and I'll throw in there Obamacare, of course, I think unfortunately we remain on a slippery slope eventually toward, oh, Canada and single payer. Dr. Vitale, thank you.